Welcome to episode number 113 of the Dental Marketing Secrets podcast. We're talking about why patients say yes, part 5, on authority and why patients trust confident experts. We are continuing our discussion on this wonderful book, Influence, by Dr. Robert Cialdini, The Psychology of Persuasion. And in this book, he outlines 6 principles, and we've gone through first 4 already, and today we're going to be talking about authority. And what I mean by authority is patients don't necessarily always just want options, right? They want guidance. They see you as the expert. They're coming to you for that direction. And when patients are feeling overwhelmed, they're not necessarily seeking more information. They're just seeking that clarity that comes from a good recommendation, a confident authority figure. They want someone to guide them along, show them what's going to happen, and that makes it so much easier for them. When people don't know what to do, they look to someone who does. And that's what the key idea is around this specific principle, is they look to authority figures for the answer. So a quick recap, if this is the first podcast you've listened to in this series, we've gone through different principles so far. We started with reciprocity and how it builds goodwill, and has a major influence on why we say yes to things. And then we talked about commitment and consistency, how that builds momentum. And we talked about social proof, how it builds safety. We talked about liking and how that builds connection and rapport and trust. And then today we're going to talk about authority and how that builds confidence. It's one of the 6 principles, like I mentioned, outlined in this book by Dr. Cialdini. It's a bestseller book. It's a fascinating read. If you're like me, that you nerd out on marketing, you nerd out on psychology, then you will really, really enjoy this book. It's replete with so many different examples from everyday life on how these principles are applied. And it's always stressed to use these principles, to deploy these principles in an ethical way, right? We're not trying to force people into making decisions that they don't want to make. And I always want to make that disclaimer as we're getting into this. I don't encourage anyone to do this and with the wrong intentions, right? But it's meant to understand the psychology behind why people say yes in general, and it's specifically to us why patients will say yes in different circumstances. So when we're talking about authority, it's interesting because we grow up with this principle, right? We're trained from childhood to defer to authority figures, to defer to experts. We don't defer to our school teacher. We defer to officers, police officers, right? I mean, if someone came and they requested hey, you need to pull over. If it wasn't someone in a police officer, would we do it? Probably not, right? But we are trained from an early age that authority figures command that type of respect, right? And deference. But what it also does, and this is important to note and to remember, is that authority helps reduce decision fatigue. It takes the guesswork and the mental labor involved with coming up with a decision, doing all that research, that kind of mental math to figure out, is this a good option? Is this, or should I do this? And it removes that from the equation, and they just can defer to someone in authority. And we talked about this with social proof and why referrals are so important. So if you haven't listened to that one, that's the 3rd one in this series. So go back and listen to that one. It's a great one because it does. And that's why referrals are so important. And authority works the same way, where it removes that burden of doing your due diligence, and you can defer to someone that you trust. That's with social proof. And in this case, you defer to someone who is in a position of authority, right? And that makes it so much easier because now we just, okay, that's what my doctor told me to do. Instead of spending hours online, scouring the internet, reading through blog posts and forum discussions and so many dead ends, to figure out, okay, is this really the right path forward for me? Plus, because it comes from an authority figure, that oftentimes reduces the perceived risk involved with taking the action, because there's someone that we respect. There's someone that in our mind has the experience and has the expertise to share these things and do so, in the best light for us, right? And the best way forward. They're the ones who've done this so many times before. And that's what patients look to doctors as. They see them as that authority that can guide them, where they don't have to, like I said, do all the mental math and due diligence, but they also trust them because they believe that you've done this before. You've been down this road so many different times with other patients that you can confidently say, this is the best path forward for you. And authority manifests itself in different ways. You see it in titles, so doctor or DMD or DDS or PhD. You see it in credentials. You see it in board certified. You see it in experience, 26 years of experience, or things like total number of patients seen or treated. That helps the patient know right away, hey, this is not your first trip down the block. You've been here for years and years and years. You have seen some things, seen 10,000 plus patients. Wow, that's a lot of patients. You know what you're up against. You know what's likely going to happen and how to prevent that. It's often signaled by uniforms, so the way we dress. And that could be even, they've done studies to show that those people dressed in business suits, especially kind of the business navy blue, the black, the gray, they receive more deference that way. They have a higher perceived authority. They did one study in the book. It showed that when a business guy dressed in a suit, he decided to jaywalk across this busy street, so many more people followed him than if just a person in normal everyday clothes, because they saw that person as having authority to do that, which is so interesting because it's totally out of context, right? And we'll get into that a little bit, and how it doesn't necessarily have to be a true authority figure, which is wild. And we see this at play a lot, actually. But authority also manifests itself in the tone of voice. You see those people that when they speak, you listen. I think of Denzel Washington is a great, he just has that way of speaking, and everyone ears, perk up. And it's so interesting how people can do that. And the command of language is one too. I mean, just their ability to articulate. And that's a powerful one that I think about a lot in marketing, because if you're able to effectively articulate exactly what the patient's feeling, their hopes, their dreams, their concerns, then they see you automatically as the authority figure. They see that trust has been established immediately because they recognize that you are fully aware of their situation. In fact, sometimes you're so aware of it that you can communicate it in much more detail than they could ever do themselves. And that's when all the lights go on. That's when they are like, yes, this is the person for me. I remember doing that when I was right out of college. I had a photography business that I started from scratch. And that's really where I cut my teeth in marketing and making things work, making the phone ring, because I had to, right? If I don't, then my family suffered and eventually would have had to go get a regular job. So anyway, that's something that I thought about a lot, is can I articulate that? Can I dig deep into what they're going through right now and convey that inside my ads? And it got to the point where I had several people comment to me after they became clients, something to the effect of, when I saw your ad, it felt like you were speaking directly to me. And that's the goal that you're trying to achieve, is fully understanding the situation that your patient's in, not just from a clinical point of view, which you do great. I mean, doctors are tremendous at this, at understanding the situation, but also from a psychological and emotional position, understanding that from the patient's point of view and being able to articulate that and communicate that to them. During that whole process, you're going to see so much more trust, and you're going to get better responses from them. They're going to get more candid answers, and you're going to be able to work through things with them so much more effectively than you would if you aren't able to connect with them on an emotional level. So those are, I just put that out there because it's something that I think about quite a bit, like I mentioned, is understanding the situation from their perspective and really speaking to that too. And it could, helping them understand that you recognize what's going on right now for them. And that's going to help them trust you more in general. So I wanted to share a few examples from the book. And I also thought of one too. I mean, the whole movie is just a prime example of authority in action, is Catch Me If You Can. It's a book that became a movie. It's a true story about Frank Abagnale Jr. is his name. And he was a con artist who went around posing as all these different individuals. And it's so fascinating. He posed as a pilot, Pan Am pilot, a doctor, a lawyer, and he would use these positions to cash in fraudulent checks all across the country, all before the age of 21 too. So it's such an interesting, so watch that. That's your homework, is go watch Catch Me If You Can and see how authority plays into this. And I think it's such a fascinating example because he's so young. He's a teenager, really, for a good part of this. But he acts like the one in charge. And he's able to do all these things that you wouldn't believe possible because of that. And it's so, so interesting. It's got great actors too. It's got Leonardo DiCaprio. It has Tom Hanks. It's got Christopher Walken. It's got a whole slew of great actors. So go watch that as your homework and just look at how authority plays into this. But other examples from the book include what was called the Milgram Obedience Study. And this was a study where patients administered what they believed were electric shocks to a learner, quote unquote learner is what they called them, to another individual. And they did this because they were told by the person in charge to do that. And the whole lesson is about how authority increases compliance, dramatically increases compliance. And it's so interesting. Yes, the person, so they had a teacher, and that was the participant that was ordered to administer the shock. And then a learner was the person who was supposed to answer the questions correctly. Whenever they did, they would just move on to the next question. If they failed to answer the question correctly, they received a shock. And each shock would get higher in watts and higher in voltage. And so it got increasingly more painful in quotation marks, because they weren't, the learners were all just actors. They weren't actually receiving any sort of shock or physical torture. But the teacher, the participants kept administering them. And that was the shocking revelation from this study, was that they complied with that authority figure. It was like 2/3 of the time, where they did all the shocks. Like they just kept going, even though the learners were screaming out like, "Oh, this is so painful," or, "I told you my heart was bad. I can't keep doing this." And all these claims, these pleas, and they continued to administer it because the authority figure told them to. Just fascinating how this works, right? There's another example from the book where showed people were much more likely to follow instructions from someone wearing a police uniform, suit, like I mentioned before, a lab coat. Each of those attires has symbolism attached to it, has authority attached to it. And we see this all the time. There's been tons of videos on YouTube where someone will dress up in kind of construction clothes, a little neon vest, and carry a ladder, and they can get into all these places just because people assume, nobody's going to come over here and try and sneak in with a ladder. I mean, they look like they're part of the crew. They're going to come fix something. Let's let these people through. So there's a whole plethora of different examples online, which is fun to look at, but more importantly, that make you think, what's at play here? Why are people allowing this to happen? So that one obvious application when it comes to attire is wearing your coat. And I know a lot of people don't like to do that. They think it's too formal. They don't, whatever, but it has shown to improve case acceptance because they see you as having more authority. It's a more visual display of your authority and your expertise. So that's an immediate one. But there's and let's talk a little bit about why this is so important in dentistry. And to do that, you just require that dentistry involves a lot of different things. There's the complexity. It's technically complex. There's health risks. There's financial investment. There's fear. So all these things are at play. And patients don't really know what they're being told in a lot of cases. They might hear the terms and they might be familiar with the terms, but they don't truly understand what those terms mean. And I've shared the example where it took me several years in working in dentistry to fully understand the process of a complete dental implant. For a long time, I just figured the implant was everything. But then later learned that it's just the actual implant itself, the screw. And then there's the abutment, there's the crown. Sometimes there's other things that need to happen as well. So grafting and there's so many things that could come to play there. And patients do hear these terms and they are familiar to them because they've heard them so many times, but they don't fully grasp the significance or the details of all those terms. And so that's something that's swirling on in their head as they're contemplating all these things. They know about they have the fear that they're dealing with. There's health risks involved. There's the financial side, which always makes things very interesting. And they're afraid of making the wrong decision. They're unsure how to go about it, right? I mean, they don't know if they were left to themselves what they would do. They couldn't do this. They're not going to DIY a dental implant to replace a missing tooth. So in comes an authority figure, in comes the doctor, and they provide all of that. They provide the direction, they provide the clarity, they provide the emotional safety, they help them understand. I get you're nervous and you're a little maybe anxious about doing this, worried that's going to be painful. Here's what we're going to do to make sure that it's as comfortable as possible. More often than not, our patients remark that they didn't even feel a thing. And that's our goal. So just walking them through that. And again, going back to what I said initially, that this is a huge blessing for a lot of patients because it removes that burden from them. They don't have to figure this out on their own, right? They can gain confidence from the doctor and their experience. They can lean on that. And that's why they come to you. They know they're not a dental expert. They know they're not a dentist. They have not gone to medical school and done all these things. And that's why they come to you. So one thing that is probably worth mentioning right now is just, and some of you may be thinking of it right now too, is what is the difference between true authority and arrogance? Sometimes those two can seem very similar. And so I think it's worth pointing out, and this is, I think, one of the reasons why some doctors choose not to wear the coat, the lab coat, because they don't want to come across as arrogant. They don't want to have this ego associated with them. And it's a valid point, right? They don't want to conjure up any of those images. Sometimes we see that. We've seen that in our lives where someone is an authority because they have the experience, but they're also totally arrogant about it. They hold it over your heads and they make you feel childish, really. And it's not a good feeling. It's not a good feeling. So I think it's important to make the distinction that authority is calm, is someone who is clear because they understand the picture. They can break it down into simple terms and meet the patients where they are in terms of understanding. They are decisive, meaning that they've already done these calculations before. They've been in this scenario so many times, they've seen the outcomes, and now they can confidently say, this is the best plan of attack. This is the best treatment for what you have right now. They're very educated. They obviously are continuing. They've been to school, but they're also continuing to sharpen their axe, to sharpen the axe to continue for continuing education. They're monitoring what's going on right now in the world of dentistry and new techniques and tools and all that. But they're also empathetic. And I think that's a key one there too, is just because they can see the clinical side, they can also see the emotional side. They can see the patient side. And they're not just looking at the x-rays. And so it's having that empathy and that ability to really relate to the patient and just help them see, yes, I totally understand what you're feeling right now, and list off what they're feeling. You're concerned about, is this going to be painful? Is this going to take a long time? If I don't do this, what's going to happen? The financial part of this whole equation, that's a lot to digest, But I also know that if you failing to move forward could be a terrible mistake. It might be a big regret down the road for these reasons. And you don't have to phrase it like that, but just again, you're still confident in the decision. Just because you're empathetic doesn't mean that you waffle over that and you let them decide. Because that's one place that I think doctors undermine their own authority, is that they want the patient to make the decision, which is important. I mean, they should, but they just kind of leave it up to the patient entirely. And that's not helpful for the patient, right? So they will sometimes over-explain things. They're too technical, too much jargon, things that the patient doesn't understand. They're not really meeting the patient where they are. They're sounding unsure. Because maybe they don't fully know, or maybe they don't have enough experience. And obviously you don't want to say things that you don't believe in, you don't believe are true. So I get that for sure. But they can also sometimes present too many options without any guidance. And that's what I was alluding to before, where they leave it up to the patient entirely. Like, what do you want to do? And I think it's good to get their buy-in. You want them to feel empowered to make the decision. But I also think you need to be clear on where you stand. Yes, you're going to help them regardless, but they need to know where you stand on this and what you would do if this were you in the chair, or if this was your mom in the chair. Explain that to them, and people, that will help them make a decision. They're not always going to say yes, because sometimes there's other factors out of your control, but it's going to help them move towards that decision in the long term. Other ways, missed opportunities, or other ways that practices undermine their own authority also include allowing the staff to contradict messaging, where they're sending mixed signals. They're not on the same page, and that undermines trust so quickly. This person's saying one thing, this person's saying another. They're all looking at me in the same office, and they're saying two different things. That is not comforting. I think another thing too is being overly apologetic about your recommendations. That can be perceived as lack of confidence. Again, if you were certain that this is the path forward, that if you feel really good that they really need to move forward with this treatment, otherwise they're going to have a whole host of issues come up, and you know that deep down in your bones, you're not going to waffle on that, right? This was someone that you cared about. This was your mom. This was your spouse. You would tell them very directly and say, based on my experience, based on what I've seen this so many different times, and it all ends up this way, or 95% of it ends up this way. And I would strongly recommend you do this. Again, you don't want to be overbearing or anything, but I think they need to feel your conviction and your surety. And being overly apologetic, it comes across as waffling, that you're not sure, that you're not confident about this. Patients want that expertise. They don't want ambiguity. So what are some practical ways? I mean, we talked about your dress, you talked about the coat, and that was one. But I think also thinking of moments in the patient experience where you can be more clear. Things like, instead of what would you like to do, it can look more like, based on what I see, this is what I recommend. Something as simple as that. Other practical ways you can do it. We mentioned titles, credentials, things like that. So make sure that you are showing your certifications. And this is not an issue for most dentists. They have them framed on the wall. Those are great. But you can also add additional things on your website, pamphlets or brochures, even on business cards, appointment cards, how many years experience you have, or like I mentioned before, the number of patients that you've seen or treated. Could speak to the advanced training that you've received, how many implants you've placed. Maybe you're a specialist and you want to be known as a veneer specialist or an implant specialist or Invisalign. How many cases have you seen? And compare that to help provide some context on why that's a big deal. So you don't just list them. Listing helps. It's a start, but it's more important to provide the context. It's explain to patients why that matters so that they can understand that and make a better decision. They can, okay, that's why I'm choosing this doctor. They specialize in implants. I need an implant. They've been doing this for a long time. I don't want things to go wrong. I'm worried about that. If I'm going to invest in this, I want someone that I can trust. Other ways you can do it is avoiding certain words and phrases. Maybe, kind of, we could try, wishy-washy. That's all. That's what that is. You're unsure, and that comes across in those words. We talked about how language, how you speak, your tone, that conveys authority as well. So be careful about your language. Instead, opt for things like the best option for you is, or what we typically see in this case is, or here's why this works. Those are great ways, great phrases to use and start to work into your process as you're working through or diagnosing a patient and recommending treatment. Other opportunities that you can convey authority, videos. Talked about the importance of videos. This is a great way to demonstrate visually that you are the authority. Have your coat on, you've got maybe your credentials in the back, you're speaking clearly and confidently about a specific treatment. Great video to put on your website. Talk about why dental implants are the gold standard when it comes to replacing missing teeth. Compare them to the other options. And explain your reasoning why you love to place implants, why you recommend implants, because that's going to come through and share your expertise, and it's going to help boost your authority. This is a good one. It's, as far as the principle goes, we've talked about a lot of the other ones that are also So effective. Authority is one that's naturally comes into play just because you're a doctor and people know that coming in. But it also, you can use that in different ways. It's amazing how when you go out of your way and do something that's not as normal, like sending a handwritten thank you note to a patient who referred someone to the practice, if it comes from a doctor, or a quick text message or phone call checkup post-op, man, that's amazing, because most people don't experience that. Most healthcare, you're not getting that. You're not getting people checking on you, especially a doctor, someone who's perceived and is an authority. They're less likely to do that. So if you can show up in those different ways, through a thank you note, through a text message, through a visit to a practice, an outside practice that likes to refer to you, man, doctor shows up. I haven't seen a doctor do that in forever, right? That's going to leave an impression because of your authority status. So all these things play into higher case acceptance, higher patient loyalty and confidence in their providers, reduced price sensitivity, they're getting better referrals. All of that adds up to benefit your practice. Again, just to be clear, we want to do this ethically. We're not trying to pressure or strong arm or intimidate or silence patient concerns and overrule them and make them feel childish for even bringing that up. We're trying really to help them see, yes, we welcome questions. I'm happy to explain this to you. I'm going to come to you, meet you at your level of understanding and show you, here's why I recommend this. And that's what they're looking for. They want, again, it just helps remove a lot of that work that they would be required to do on their own if they didn't have someone like you there. So, a few homework items for those that are excited about this, like me. Go and watch Catch Me If You Can. If you've seen it before, great. Go watch it again. Look at the ways the authority comes into play in that movie. And then think of one place in that patient experience where you maybe have a tendency to overcomplicate explanations, or you're not speaking confidently enough, or you fail to give a clear recommendation. And feel free to be vulnerable and ask your staff if that comes up, and welcome that. Don't say they're going to get in trouble for ratting you out or pointing the finger at you for this or that. No, we're all about growth, and we need that input and feedback in order to do that. So identify one place where you can level up with your authority, where you can speak more confidently and more surely. So that's it for authority today. This is the 5th part of a 6-part series. The final principle we'll talk about next time is scarcity, why limited availability increases action, and how to ethically use that in your dental practice. So thanks for joining us, my friends. If you need help, if you are looking for marketing help, we'd love to talk with you, see if we're a good fit. Reach out to Maria. That's Maria, Maria, at markthackeray.com to get the conversation started and see if we can set up a time to talk more. But we'd love to see what you're up to. And if you have questions, feel free to reach out to Maria at that same email address. And until next time, be good.